there a report? Is there a consult? Is there a supplement recommendation? What does that look like with EndoAxis?
Is that the report really is complex enough to be your consultation, right? Like we are giving you
Okay.
a lot of information, but we do it in a way that hopefully is easy to digest. And again, we're breaking this down into those relationships, into patterns. And so you have kind of like lump themes of patterns, but what makes them nuanced and unique is maybe like here's an estrogen dominance with low progesterone, or here's an estrogen dominance with low progesterone and poor metabolism, or over aromatization, or you start pulling in all of these different caveats that really boil down a unique pattern for a patient. And that's what we've done is we've kind of named these patterns. So for women, you have 236 patterns. And just to reverse back, you're basically you're taking a Dutch complete or a Dutch plus. That's what we want to interpret. There is validity in just having isolated hormone analytes or adrenals, but when you're looking at the whole picture and you want to really create a personalized plan of action for your patient, you need to know both. And so that's why we're just doing the Dutch complete and the Dutch plus. We're doing them for men and women. Once you have your result, you upload them into our program. And again, this is an algorithmic program. This is calculations. It's basically funneling down where are the ideal ranges? Where do they fall in those ranges? And what are their unique relationships on their report compared to themselves versus compared to the average for their age? And then we integrate that with their cycle status. We integrate that with any bioidentical hormones they might be on. We take into consideration other life circumstances, like are they breastfeeding? Are they pregnant, right? Are they on birth
Yeah.
control? Because that's going to alter everything. But also, do they have a cancer history? If they have a hormone dependent cancer history, that could change how we're looking at these ranges and makes some of the metabolites kind of our cutoff for normal. It makes them a little more narrow. It's saying like we have a very low threshold for 4-hydroxy in that case, for example. If that's going high or 16-hydroxy ratio is elevating, that's going to be a concern for that patient over someone who doesn't have a cancer history, who maybe our buffer is a little larger. We still want to watch those, but we're not going to be as critically concerned about them. So we do narrow the ranges based on different circumstances. And then that generates out 236 different patterns for women. I want to put an asterisk there because it's 236 times 4. There's actually 4 unique comments per pattern. And those comments are based again on their cycle status or if they're on bioidenticals. So there's actually over 900 comments. So you really do get a personalized comment for your patient's pattern. And on the report, once you upload the report, you get this within 24 to 48 hour turnaround. Our system's running it through the calculations and it's generating your pattern, right? Plus any unique variables that are specific to symptoms or other factors that you don't want to miss. We don't want you to miss as a provider. And those are called our findings. So we do this for the sex hormones. We do this for the adrenals, and we give you 2 different patterns.
Okay.
We do relate the adrenals to the sex hormones in some of our findings if there's considerable like dysfunction between, say, for example, DHEA and cortisol, right? We want to pull that out as a relationship that says, look, this is probably more an adrenal dysfunction versus maybe a high stress picture versus a hypothalamic dysfunction. So we really do bring all of that information at your fingertips so you can look like a hormone expert without having to sit and comb over that report for hours and without having to wait
Because you've done it all
weeks
for
for
me,
a
right?
consult, right? Yeah, you get that consult note right there. And they're 11 to 14 pages in length. You get the really streamlined pattern notes saying this is the high level. These are the dysfunctions that are really impacting this person right now. And if all you wanted was to read that first 1 to 2 pages, you would be well armed with information. But if
So
you're
I
someone
don't
like
have to
me,
read 14 pages to
no,
know the takeaway.
absolutely not.
Could still
It's that
sound like
summary.
my smart doctor self if I looked through the summary and it was like, these are the big hitters. I can take that and still understand what the Dutch test is trying to tell me.
Absolutely.
Okay.
Yeah.
Okay.
Yeah. So we kind of like boil it into here are your high level bird's eye view key take homes, right?
Okay.
Including like if there's additional labs, like, hey, don't forget to measure their thyroid. Don't forget to look at their blood sugars. Like this is a person who's
Okay.
really looking like their gut might be out of balance. Maybe consider a GI assessment if you haven't already. We really pull that all into that first summary page. And
Okay.
then we have like our insights section. So we have an hormone insights and an adrenal insights. That's expanding a little more. So if you're like,
Okay.
well, I get what this is saying, I get what I need to do, but I would like to learn more about estrogen metabolism, because this seems a little odd to me and I just want to know more, right? You can read the insights and get what I would call the Sparks Note version on just those relationships, just looking at like the hormone at estrogen detox, right? We just boil that down for you. Or the estrogen testosterone ratio, testosterone metabolism, estrogen progesterone ratio, right? We boil those relationships down into key features that
So if I
give
only
you more
wanted to learn
information.
about estrogen detoxification, I could go to that part
With that
and
section.
look at just estrogen detox.
Yeah,
So that's also
absolutely.
pointed out for me. Awesome.
It
Okay.
is. Yeah, we have them all categorized for you. So you could just go right in and you can say, well, all I want to know is really like what's happening with this testosterone. Just read the
Yeah.
testosterone notes.
Okay. Okay.
Now we do pull out some findings that relate to, again, the symptoms and what we're noting in the report. So like if this patient's struggling with acne, but really their metabolites of their androgens don't look that out of balance, we're going to pull in all the other things that could be considered for that patient that could be resulting in their acne that are maybe not androgen related. With the caveat, we also make this note that sebaceous glands, and this came out in the research recently, so cool, sebaceous glands actually have CYP17A1, which means they can generate testosterone and they can generate DHT. So you can have sebum tissues, so that's like the oil glands, right, in your
Yep.
skin. You can have them generating their own DHT, which is the most potent form of testosterone that can actually increase acne, but it may not reflect what's happening anywhere else. Their ovaries might not be making a lot of testosterone. They might not be making much from the adrenal sites. They might not actually have a lot of systemic testosterone. It's just all being made by the sebaceous glands.
So you're telling me
Um,
even if I look and I suspect that my patient's going to have all of this testosterone or androgen activity, when we look on the Dutch test at like the testosterone levels, that may not be the only thing that's influencing their acne
right.
because there's these magical things happening just on their own in their own glands.
Absolutely. Yeah, it can be local, right? So we do mention that.
Okay.
And you can send to a dermatologist and they can actually do a biopsy and just see like is there like concentrated DHT in that tissue?
Mhm.
Because you probably want to treat that local versus with systemic androgen
Right.
inhibitors, right? Or 5-alpha
Right.
inhibitors.
Well, and what would happen
Um,
if I wanted to treat it systemically? Would it affect the acne or what would happen?
It could, because you're influencing the enzymes, right? And
Yeah.
that's hopefully you're influencing the enzymes. It depends on the blend, or how you're targeting it. But you probably are going to get a response. The problem is if you're globally inhibiting 5-alpha reductase, you're reducing the anabolic potential of DHEA and testosterone, which if they systemically don't have a problem, you could actually increase the risk for fatigue, for poor muscle growth and development, for low libido, mood changes, weight changes, just by altering that enzyme more globally instead of working on just the local tissue. If it's a global problem, absolutely treat it globally. But if it's
Yeah.
a local problem, you want to differentiate. But there's other culprits to acne, right? Like, and we outline all of that for you in our report. We say, like, don't forget about their gut and food sensitivities. And don't
Okay.
forget about just like the skin microbiome and how
Yeah.
important it is to balance with that very critical and kind of unique microbiome that exists on the surface of our skin.